Jeff here with Entrepreneur Essentials once again, and we're just all tight and cozy here. First time we've had 3 folks on the show, but this one's a really special one because this is one of our neighbors up the street, and I think a very intriguing concept. When I first learned about this, I was very shocked that there's opportunities like this out there for, especially for entrepreneurs who need medical care. As entrepreneurs, quite often we leave a job where we had, group health care and everything's fine, and then we get out as a business owner and find out that our medical care is about 2 to 3 times as much as what it was before. And we also get to the point where we realize, okay, we're not getting as good of care probably as we were before. So I want to introduce you to the Millers, Dr. Miller and her husband. And we're going to talk a little bit about direct primary care and of course Premier Healthcare, their business right up the street from us. So once again, always below me is our subscription button. Make sure you click on that, and you'll make sure you get all these great entrepreneurial stories every week. So why don't y'all tell us a little bit about what direct primary care is first off?
Absolutely. Okay, so direct primary care it's not exactly an alternative to insurance, because a lot of times people do need insurance for catastrophic things, but because most people's insurance these days have very high deductibles, you could easily have a $5,000 deductible, people are paying cash for their health care in most cases. And so direct primary care is a movement of doctors that started up generally in primary care. There are some specialists, but mostly primary care, where people can get treated like a VIP and get the concierge care experience, but for anywhere from $55 to $99 a month. And so typically it's patients get the doctor's personal cell phone number. They generally get unlimited visits and come in anytime they want at all. They also included with that, there's never a co-pay or a deductible or a per visit charge, so people can come in even when they're not super sick. That way they never have to get super sick and get that very expensive ER bill. They also get their annual lab work all included. For women, that includes a well women's exam. So really trying to package all the services of access to the doctor anytime you need, and very affordable care for just a very good price.
Yeah, that's fantastic. So what type of care, typically what would I be going to see you for?
Well, I'm an internist, so I specialize in internal medicine, and I take care of adults and some adolescents ages 13 and up. So basically I take care of everything that you would need besides surgery and obstetrics and what else? And that's pretty much, I cover everything.
Okay. So if I saw my arm off, go to the emergency room, don't call you first.
If you have a cough or a cold or a sore throat or an infection of some sort or bronchitis, those are all the things she takes care of.
Absolutely.
And diabetics and patients with hypertension and other chronic illnesses, I manage those as well.
And I know we've had some. We did a panel with the Texas Freelance Association a few months ago, and we were also talking about, okay, what are some other alternatives? I know one really good alternative, and it's in fact what I use, because I use y'all, and I've got the Liberty Health Share plan, which is it's a Christian-based healthcare, or it's a religious-based healthcare plan that, in fact, they actually give me credit for using y'all. I get credit towards what I have to pay out, or my almost deductible or whatever every year, which is, I thought it was very intriguing, and it's kept our healthcare costs down pretty significantly. I know for here, because I pay 100% of healthcare. So
Exactly.
so tell me a little bit about what made y'all do this.
Well, she had been a hospitalist for about 10 years. So nowadays most family doctors don't go see people in the hospital, so they have a doctor that takes care of people in the hospital. And she had done that for about 10 years and was getting tired of working 100 to 120 hours a week. And she really, a lot of times, had patients that would say, "I'd like to come see you in your office." And she always had to say, "No, I don't have an office." And so
This is it.
exactly. So I said, "Why don't we open an office?" And we looked at regular traditional insurance taking practice, and you get to spend 5 minutes with patients as a doctor and don't get to spend time with them because you're on the clock, because you're really working for the health insurer, not the patient. And so I said, why don't we find a model where we can work for our patients directly? And that's when I found the direct primary care model. And there's about 1,000 doctors around the country that are doing it.
Yeah, and do you see that being an increasing?
It is. It's a
Yeah.
very, very fast-growing group of doctors, and I think in 10 or 15 years, most doctors will be doing this.
Which is
At the
fantastic.
rate healthcare is
Yeah.
going and getting more expensive.
Well, the scary thing is it's actually in some aspects going back to the way medical care was before
It really is.
the insurance industry screwed it up.
That's exactly right. That's exactly right. Yeah.
The way one of the ones that was here at the direct primary care physician we had here for the panel that we did, I said that to him. He said, "Yeah, we just don't take chickens."
That's right.
So other than that, it's pretty much the way it used
That's
to be
right.
as being
That's
a
right.
doctor.
Exactly.
So for you, has that made your life as a physician better?
Much better. I basically don't have to speed through patients every day, work nights and weekends, and never see my family. And so now I get to spend time with patients. I get to know them better over time, and then I also get to see my family as well.
Well, that's kind of the bonus plan on top of there. Yeah, I actually get to see my family, and they're not just a picture on my phone. So what are some of the challenges of being direct primary care?
Well, the first thing is a lot of people don't know what direct primary care actually is.
Exactly.
And so one of the big challenges we've had is starting a new business is just getting the word out, so that people can find out what direct primary care is and find out that even if you have insurance, it's still a great option. And if you don't have insurance, it's a great option too.
Yeah.
And so really getting the word out has been the main obstacle that we've faced.
Well, I think, I thought of that, but if you have traditional insurance, why not go to you? Because you're typically going to have a couple $1,000s out of pocket anyhow. Might as well
Exactly. Get
might
a
as well
much
have
better
that.
experience.
Yeah,
Absolutely.
significantly better experience in the long run.
Absolutely.
And then you've got some relationships with testing facilities
Absolutely.
and pharmacies and all that helps to. That was the other part I was shocked. I know you'd presented before, David, on the how the medical care industry works or healthcare industry works with insurance and prescriptions and things like that too.
Right, absolutely. We've negotiated deals with local pharmacies and imaging centers, and so what would be a $20 to $30 to $40 lab test, like a cholesterol test at a traditional insurance-taking doctor's office, we get that for $2.85. And we pass all of our costs like that just directly on. We do not mark them up. So we're not trying to make money off of having tests done or imaging or anything. And even in terms of pharmacies and medications, we have ways of getting people coupons for local pharmacies, and there's even a mail order pharmacy that we use, which actually is cheaper than if we started a pharmacy ourselves. We were going to start a pharmacy ourselves and sell everything at cost, and we found this pharmacy and said this is even better.
And you don't take the risk of having to deal with all that part
Exactly.
of it. And that's
Exactly.
fantastic. So what's the future of of your business, and where do you see this going?
Well, I think we're going to expand, obviously.
Okay.
The way we can guarantee the 45-minute appointments and the incredible service that you get is that we are limiting our practice to only 600 patients.
Okay.
A typical primary care doctor's office in the Austin area has between 2,500 and 5,000 patients per doctor. So this is a way that we can guarantee the good service. And so once she reaches her 600 patient limit, we'll probably bring in another doctor and start getting
divide
into
out the
exactly.
the crowd a little bit.
And then at that point, we'll see if we want to continue expanding to multiple locations. At the rate that this direct primary care is growing, it seems likely we will.
Okay. Would you stay in this area, or would you look?
No, I
areas?
definitely think the Austin area is where
Okay.
we would want to stay. I
Okay.
think we love the area, and we want to be here.
Yeah, and you don't want to be driving all over town. Gets back to that whole, I want to be around my family at that
Exactly.
point. Well, that is phenomenal. I mean, I think it's like I said, for me, it made so much sense right out of the gate, and from an employer standpoint, from an entrepreneur standpoint, it is a way to get wonderful care without having the massive expense and not the massively rising expense every year as well, which I think is
Exactly.
amazing.
Right, because our prices are what they are, and
Yeah.
we're highly transparent, and
Yep.
so you don't have to worry about it. Premiums going up because
That's
we're not
it.
raising rates.
Yeah, and the waiting room is like going to a
There's-
spa. So
yeah.
it's
we wanted it to be concierge medicine, but for normal people.
yeah.
So you don't have to be a millionaire to have a doctor that knows you and get to have an appointment in a nice environment.
And you don't have to go in and sit on the stupid paper table thing
right.
and sit in there on the uncomfortable table, which
That's
I think
exactly
is
right.
incredible. So,
Exactly.
well, thank y'all. We
Absolutely.
appreciate you coming in. How do they get a hold of you?
Well, they can always reach us online. Our web address is www.premierhealthmdtx.com.
All right, very good. And they can go on there. That will actually be below on the show notes page. So if you want to get a hold of them, just click on that web address, and you also see what the facility looks like and everything else, what the office looks like. I highly, highly, highly recommend. I think we're going to be having a live Facebook panel again here pretty soon in the next month or so, talking about healthcare and alternatives to the traditional healthcare system, and hopefully y'all will be there
Absolutely. Absolutely.
to really talk about that. But I think it's a great way to bundle together a significantly better healthcare that makes sure that you're taken care of over time, instead of making a decision of, do I go to the doctor or not, because it's going to cost me a ton of money.
Exactly.
So thanks a lot, and folks, y'all have a great day, and we will see you back here next week.